I started getting bulging veins in my lower right leg.
This is Lauren Radozic.
I've had problems with ulcers and varicose veins.
Lee Haas.
I have AFib, but my legs were bothering me quite a bit.
And Robert Hoover. 3 very different people with one common problem: vein disease. But all 3 took advantage of the innovative techniques offered by vein care specialist Dr. Ravi and his team at North Ohio Heart Ohio Medical Group.
Vein disease is a very common disease. So when there is a problem with the valves, there is a tendency for the blood to leak backwards, especially with the gravity. When we are standing or sitting, the blood can leak backwards.
That's how Lauren Radozic's problem started.
The veins, you could visibly see them, and you could actually feel the bump of the vein. It would get red. It actually sometimes would hurt.
So Dr. Ravi used a combination of treatments, lasers and injections.
Nicole would scan my leg on the ultrasound, and it was actually very comfortable. Dr. Ravi would come in, and we would either do lasers in one session or we would do the injections. There is no downtime. I drove myself home. You could go back to work. You could go to the grocery store.
Lee Haas had surgical vein removal to improve his varicose veins, but it did not work out as planned.
I had the varicose veins taken care of probably about 10-12 years ago. But ever since I had those surgeries, I've had reoccurring ulcers. What was happening was blood was draining down to my ankle, and it was hindering the healing process for my ulcer.
We call it as venous ulcers. These are chronic conditions. We know that treating the varicose veins after these venous ulcers heal will prevent patients getting the venous ulcers back again.
It's minimally invasive.
If I was awake, I could see what the procedures they were doing, and I didn't feel any pain or anything.
And successful.
It was very exciting because now I could go swimming again. I've been able to get back to normal life. I can bowl, I can golf, I can do all the activities I love to do.
Robert Hoover's treatment called for some ingenuity.
When I talked to Dr. Ravi, he said he wanted to try something new on me, which I thought was outstanding, was the glue. And I said, the glue? And he said, yes, the glue.
So these are simple procedures. We put the catheter into the large straight veins which are leaking and drip the medical adhesive in so that we can close it. Simply, it's known as glue.
He says what they wanted to do was close that vein because it was just sitting there with blood and causing the swelling. And he says the body will develop new veins, which it has. Now I can do normal walking. I've gone swimming, exercising on the bike.
So when a patient comes to our office, we rely on teamwork. I believe that it is not just one person treating the patient, it's the whole team which takes care of the patient. We trust each other.
With Dr. Ravi and Nicole, I just felt really at home. I felt like I was going to see my friends.
I am actually now getting my other leg done because I do have some leakers there.
So I've talked it up to everybody. It says my legs are hurting or something like that. I said, you gotta go see Dr. Ravi.